Counterstraining the quadratus lumborum is an excellent tool to have in your toolbox. The quadratus lumborum being tight is often the cause of elevating one side of the pelvis, which in turn elevates the shoulder. A tight quadratus lumborum can also be associated with a weak gluteus medius. So there's plenty of reasons to be able to get rid of that trigger point in the quadratus lumborum, and today I'm going to show you a couple of methods. The first one is a counterstrain. So first you have to find the tender point. The tender point for quadratus lumborum. Quadratus lumborum runs from the 12th rib to the iliac crest. So if you find the iliac crest and find the 12th rib, the quadratus lumborum will be in this area. Now what you want to do, it's deep to the paraspinal, so you want to take your fingers, run it around the roundness of the erector spinae, and then gently press in. This is how we palpate quadratus lumborum. So around the roundness and then press in. If it's tender, this is the counterstrain position to treat it. Pull the knee up and out to the side. This creates side bending and rotation in the lumbar spine. So it's the only reason to have it in this position. If the knee is near 90 degrees or sometimes just a little bit past it, you'll get adequate side bending. So it's best to help maintain their leg position by keeping most of their leg on the table, and then you're just supporting it here. I even have my foot on a stool here so that I can rest my elbow on my leg, but I'm going to maintain this position. Recheck the tender point. You will hold this position if that tender point is 70% less or more. Okay, we hope it's gone. So you're going to hold it here for 90 seconds. After 90 seconds, you want to passively return to neutral. It's 90 seconds, take the hand and then passively return to neutral, and then recheck the tender point. If that was unsuccessful, you can use a manual technique to lengthen the quadratus lumborum in sideline. So I'm going to show you that now. Go ahead and lie on your left side. Just for purposes of this video, we're going to demonstrate the release of her right quadratus lumborum. If the patient lies in the 90-90 position in sideline, you can use the pelvis to have some leverage to stretch the quadratus lumborum, which runs right here. So I will place a stretch on the quadratus lumborum, and then using some lotion, I will do a vertical stroking of the QL from the 12th rib to the iliac crest. Now notice the position of my thumb. It's not here on the back. Remember, the quadratus lumborum is deep to the erector spinae, so you want to get in front of the erector spinae and place a downward pressure or a medial pressure when you do this technique. So it's just pressing with consistent rhythm and consistent pressure, and I'm just elongating the muscle by pushing this side of the pelvis down. So in a sense, I'm creating a left side bending, lengthening this right side of the quadratus lumborum. Okay, this method works really well too in alleviating that quadratus lumborum tightness. So try one of these two methods to get rid of QL pain.